with Dr. Vanita Zahn.
It's not just COVID-19 that's a direct health threat, but it's also an indirect threat. The stress that this time is having, it can negatively affect our mental health. And we've had guests on Health Beat to discuss that. So how can we protect our mental and emotional health? Well, that's something the American Foundation for Suicide Prevention is tackling. And the director for the Capital Region chapter, Sandra Goldmere, joins us to discuss their project. Good to see you, Sandra.
Good to see you too. Thank you for having me.
So we're not talking suicide specifically because at this point there are no numbers, but we do know that emotional health is taking a toll. So your organization has a project going on now. Share with us what that is.
Yes, we've really been focusing for the entire time of the for COVID on really looking at mental health and how important self-care is. So when we do our standard trainings, which we've been converting to virtual called Talk Saves Lives, we've really been engaging also in discussing mental health self-care and how important that is, and really that it is what will cause prevention of any manner of mental health stress or crisis at this time.
So what does mental health self-care look like? What are the practical takeaways we should know?
I think it's really a mixture, and it's everything. It's mind, it's body, it's soul, it's surroundings. It's everything from making sure that you take care of your physical health. And that's not just getting out and taking a run, but making sure that you're taking care of all of, the mundane things, making sure you're eating really well, sleeping really well, reducing maybe alcohol and caffeine intake, things that really will guard your physical health and keep it as healthy, as strong as it can be. Because when we are physically strong, it can support our mental health. And it can also include things like going out for a run, participating in yoga, taking on maybe one of those online physical challenges that they now have that you can do. But it's also things for your soul. It's making sure that you are engaging in positive social media. We are really inundated every day with social media about the coronavirus and opinions on all sides of the spectrum, but it's really making sure that you are really deciding what is good for you to do, and if you need to take a break, taking that as well.
Isolation is a big issue for those who are otherwise healthy, for loved ones who may be in a nursing home. We talk about the broken heart syndrome, and that can be deadly. Have we deal with the isolation? What are some suggestions?
I think the really suggestions, we talk a lot of, there have been a lot of comparisons to the influenza epidemic in the Spanish flu. And at least now we do have, for those people who do have access to social media, and not at social media, but internet connection, the opportunity to really engage with other people. I mean, I watch my own mother, who every time I connect with her, she's playing bridge online. She can't do it in a bridge hall, but she plays it a lot. It's finding ways to connect with people. And that is one of the things that really is important for those of us who do have access and connection and ability to get out, is check on the people around you that may be more isolated, whether it be, and who aren't as safe to go out, whether it be to drop off cookies at their front door, or just check in on them, or make sure that you're texting with them. Whatever connection capabilities that we have, it is, they talk about socially distant, and I really wish in some ways that we had termed that as physically distant, because right now social connection is even more important. So it's not about being socially distant, it's about being socially connected while being physically apart.
And are there some hallmarks that we should be alert to in loved ones and ourselves that say, you're really running into trouble and you need to reach out for professional help?
I think that, it's about prolonged change in your own behavior or somebody else's. Say somebody has been checking in with you by text and isn't responding to text so much, or is talking more about just feeling down or being more connected. But for some people, it's anxiety. It's having a lot more anxiety about what's going on. And that's why the self-care is so important. And for each of us to check in on the people that we really care about, because that is where we're going to know. And it's also being willing to have what we call the real conversation, which is that if you are concerned about somebody else, is to really ask them, frankly, if they are struggling. Because for what we've found through research, actually, when it comes to suicide prevention, but it's no different in this case, is that people who are struggling really want to be seen and heard. And if somebody actually asks them in a really kind and open way, and they may be willing to open up with you, and then they may be more willing to see somebody because they are feeling seen and heard.
And the sort of the footnote on this is that there are virtual visits that can go on with a mental health professional. So if you're not comfortable leaving your home now, the doctor will see you in your house.
Absolutely, and it's not just doctor visits. There are support groups that are available online. There are therapy sessions that are not just individual but group therapy. I met recently with somebody who works at a facility, and they said that they are still doing support groups online. So I think that it's really being able to know that the help is out there if you need it.
And that is really the key. Sandra Goldmere with the American Foundation for Suicide Prevention, the director of the Capital Region chapter. Thanks so very much. And you know what? It was nice to visit, even though it's virtual. It's still a good and important visit. And I want to thank all of you for joining us. And in fact, for more information on the American Foundation for Suicide Prevention, just check out the link section right here on our website. We'll see you next time.